Welcome back, everyone, in our Facebook and Twitter Live communities. We're really happy to be here in the hashtag #CArthritis booth with Dr. Jason Kerr, who is a clinical assistant professor at the University of British Columbia. He also is the president of the BC Society of Rheumatologists. So we really thank you, Jason, for taking time out of your busy day. We know that this conference is sort of back to back to back. Science and learning and networking with your colleagues, so do appreciate so much your time. We wanted to chat with you about rheumatology, go figure. Given your role as president, and also your role as a clinician who's operating as president, so you have to put your administrative membership hat on as well as your own clinical hat on. Tell us about some of the things that you feel the BC Society of Rheumatologists have done here in this province that are working towards improvements in models of care.
Well, first of all, thanks for having me.
Oh, you're more than welcome.
Always happy to participate.
Great.
I think we've had some very great successes with rheumatology models of care in BC.
Yeah.
Over the past 10 years, we have looked at changing our model of care. So traditionally, rheumatologists sort of worked in silos with their office assistant and communicating to the family doctor the information of a patient visit. That model is changing now because we've been able to incorporate nurses quite successfully into almost every private practice scenario in the province. And this has allowed rheumatologists to completely change how they work.
Wow.
It's completely changed how rheumatologists interact with their patients. And I think the great thing is it's been a huge benefit for patients because it's more time with a healthcare professional who understands their condition.
Right. So the rheumatologist in this model, this improved model, Jason, is still spending that sort of quality, kind of expert care time with their patient, but the patient's getting additional support and information that I think only rheumatology nurses actually can do. Can you talk about the rheumatology nursing role in sort of specifically for us?
It's really evolved because it is a completely new field.
Yeah.
We went, 10 years ago, there were only rheumatology nurses at some very highly specialized centers, and since then they've kind of expanded throughout the province. So the role of what they're doing has expanded as well.
Yeah.
A lot of it centers around counseling and disease education.
Okay.
So we've actually looked at this in some of our surveys of what's happening on the ground. But nurses, the number one thing they do is education. Okay. Lifestyle education, pain management, nutrition, all those things that sometimes get left behind. The second biggest thing that they do is education about medications.
Yeah.
Helping patients understand the ins and outs of the different medications that are out there and what to expect and what to look for, and some of the good things and some of the bad things that they also need to be aware of moving forward with whatever choice that the patient is making with the rheumatologist.
Right.
So those are the sort of the kind of the key roles that the nurses are doing.
Yeah.
The other thing that's, I think, great for patients is the added value services that we're able to provide that used to be farmed out to the community. So being able to offer vaccines to our patients in-house, I think, is a huge benefit. To not have to send your patient to go, you have to go to some public health unit, you have to go over here, go to your family doctor. To be able to do them with a team that you trust, I think, is really important.
Yeah.
Things like getting tested for tuberculosis before biologic medications. That was another one of those pain points in the system where it was really slow. People are like, why are you sending me to the TB clinic? I don't have TB. And not understanding that was part of something that we had to do. Yeah. But being able to do these things with our nurses in our offices just streamlines everything for the patient.
Wow, it sounds like nirvana, actually. and I'm not saying that as a casual observer, just listening to you. I experience the benefit of a rheumatology nurse in the clinic that I attend. And I have to say that what I like most about what I've heard from you, Jason, in these progressions and the building out of this model of care in particular, is that the things you've just mentioned are things we hear from our membership all the time. These were truly pain points for patients. And it sounds like you've kind of gone through the list of those and tick them off very effectively. And how about cost effectively? Does that work as well?
Well, that's our hope, and we think we analyzed this in some small surveys, but those visits that would have been done that are being done by our nurses in our office would have been referred to other healthcare professionals. So
Yeah.
I think there is some savings in that, because instead of sending them back to their family doctor to another clinic for their testing, we're actually doing it in-house as part of one visit. So I think there is an argument to make that there is some benefits to the system.
Yeah.
Not to mention the benefits for the patient. They don't have to take another day off work or another half day to go to some other clinic. Like, it's I think it's very beneficial for all involved.
So the cost savings are probably equally great in the actual patient's world, as well as probably some savings in the healthcare system, just efficiencies.
I think it's great. It's great for both sides,
Yeah.
for sure. And when you think about, rheumatologists aren't in every community, and you can't have, it's easier to do these things in one spot when you're at the doctor's office than to have to, try and find another time to do it.
Yeah.
Right?
This rheumatologist not in every community leads me to ask you this, switching maybe gears a little bit, is how we know that the population of Canada sits along that invisible line called a border between Canada and the United States, and that means that the rest of the country, when you look up, population is spread, and we call those areas all rural, remote.
Yeah.
How does the BC Society of Rheumatology, rheumatologists, how do you deal with that? How are you looking kind of forward thinking about geographic distribution?
Well, physician planning has been one of the hardest things to plan for in Canada.
Yeah.
Since physicians started graduating from medical school.
Yeah.
And we had some big issues at least 10 years ago when I sort of started in this role. I was a member of the lowest graduating class of medical students in 2001.
Wow.
Before they started increasing graduate numbers. So we definitely were at a time where there were very few graduates and very few graduates choosing rheumatology. So we started looking at this by quantifying where the rheumatologists were and how short we were in terms of the distribution. And then there's been a lot of efforts to try and increase awareness about rheumatology and make it a more attractive field for graduates to choose. We're starting to see the payoffs of those efforts. More residents and trainees are interested in rheumatology. We've made, with things like the model of care, we've made it more attractive to people because new graduates want to work in teams. They want to work in creative ways to deliver patient care. And now we're starting to see that trickle down into the communities. So we've had some successes. For a long time, we had no rheumatologists in Surrey, which is the second largest city in the province.
Yeah.
And now we have new graduates setting up there. We have other people that are setting up clinics in Surrey.
There's a new PT clinic that's opened up there.
There's an early rheumatoid arthritis clinic there as well. So there's some great stuff happening there. We have our first rheumatologist in Prince George, which is going to be phenomenal, which will help sort of supplement what happens with some of our traveling clinics.
Yeah.
So we're seeing some of these sort of the trickle down effect of those efforts that we put in over the past 10 years.
Yeah, that's tremendous.
Yeah.
Really tremendous. And I heard news of the rheumatology locating to Prince George, and I cheered there because we've done so many workshops up in that area. Where ACE ended up being the rheumatology expert. So we were from a patient education perspective, but certainly there seemed to be a significant void. And so happy for our people who are tuning in from Prince George that there is now a rheumatologist firmly planted on the ground. That's tremendous.
And the other thing people may not be aware of, we've also been working on initiatives with telehealth. So, there's not sort of one solution to getting everybody in the province seen. There's always going to be more doctors in Vancouver and in the bigger cities, but with the outreach traveling clinics, with telehealth as another option, where we're able to engage with patients in different ways. And we've had some leaders in our society who've been pioneering telehealth and helping other members incorporate that into their practice so they can offer it to their patients.
Yeah, and I think patients will go nuts for that, frankly. There are times when, I'm busy at work, and if I could just have a 15-minute consult with my rheumatologist or my rheumatology nurse and get whatever information I'm needing or a new script or describe a problem that may be able to be dealt with by phone or by video conference, hooray.
Yeah.
Because we're all busy. I mean, patients are busy too.
And it's never a substitute for the face-to-face
no,
visit,
of course not.
But it's a great supplement. So if in a patient in a doctor-patient relationship that is well established, that you understand the person and you know them well, it's a great supplement in between visits or as a substitute for maybe more routine care.
Yeah, so that's a great point. Supplement, not replace.
Exactly.
Yeah, fantastic. When you think about sort of the work that you do with other specialty physicians, and then the global, because there is a, Doctors of BC, so there's a sort of an umbrella. How does that interaction work? Does it work? Or will I get you in trouble by asking you that question?
There's so much happening in healthcare.
Yeah.
There's a lot of focus on primary care because there's so many gaps there. But I think there's more and more realization about the role that specialists play in delivering primary care. Because a lot of what we do is primary care with someone with a chronic condition.
Right.
That the family doctors aren't able to meet that need because of the complexity of the issues around the medications and the care. So I think there's more of a recognition now at some of the larger tables in terms of government and the other doctors associations that specialist management of these conditions is part of that primary care puzzle.
Right, and are those sort of in the I don't want to say higher up, but in the kind of the broader viewpoint of physician representation at government? Are they making those representations on the rheumatologist's behalf, or do you actually go and do that yourselves?
No, we go and do that ourselves.
Fantastic.
So we're at the tables with all the other specialists and family doctors and advocating for these areas of gaps that we see.
So I understand that's how the nurses and billing code came about.
Yeah, it basically came from us tirelessly working hard and showing where we needed people, that we were one of the most underserviced specialties in the province, and that we needed to develop some new innovative ways to try and address the shortages and the access to care issues that we were experiencing.
Well, congratulations, because not only have you done something that's helped your practice, you've helped your patients an awful lot by doing so. We're just going to turn to the audience and ask if there are any questions.
What is the role of the rheumatology nurse, and do people end up seeing the rheumatology nurse more than they see their rheumatologist?
That's a good question. I think this is still an evolving field of how we best use and engage a nurse in our practices. And every physician's doing it a little bit differently in BC from what I've seen, but for the most part, the nurses will be part of the visit. They often will convey information back to the rheumatologist. But there are many times where a patient may have just direct contact with the nurse. I use my nurse to call patients back around issues about lab monitoring and things that I may not have time to do in my regular day. And then they may actually see the nurse for other issues separately when I'm not in the office, if they need to have some of these other immunizations done outside of an office visit. So primarily they're going to be involved as part of the team-based decision making, but then they have all those added roles that they can play that can make the whole patient experience that much better.
I love the way you concluded that answer, which was the patient experience. And it really is trying to shape care around patients such that it meets the individual needs as well as the sort of the greater population of patient needs. That's nice. We good? So we likely will have more questions roll in through Facebook and Twitter, but we'll deal with those that we can. And if not, I might haunt you by email and ask for specific answers. But we just want to thank you so much, Jason, for coming in. You're always delightful to speak with. And you always bring good news, like improvements of models of care and exciting changes that have gone on that have had tangible benefit to patients. So thank you very, very much. And we thank you for joining us. Stay tuned for our next interview.